again to the continuation of our question and answer session. Here with the subject of biology, you're with me, Munir Mustafa, as we continue to look on questions which occur in examinations. As we're still continuing with the Form 1 syllabus, we're going to move on to our third topics. Now, let's begin. Our first question tells us to define what is immunity. As we all know, a question like this is just a simple definition question in which it requires a person to recall or to remember on what is the meaning of the word immunity. That is what this question needs. As we all know, immunity, we can just, in a quick way to talk about it, we can just say immunity means defense. That is just a simple meaning of immunity. But in a biological way, we can just say immunity is the ability of the body to fight or to resist against diseases and infections. That is what is the meaning of immunity. As we said before, immunity means defense. So, talking about defense, we can just say, for example, those who like to play football, they know that there's a position in football in which people are called the defenders. Those who have the job of keeping their goal safe. That is what defense means. Defense just simply means to defend something from another thing. And immunity in terms of biology means the ability of the body to fight against or to resist against diseases and infections. So that is what immunity means. That is our first question. Question B says, state the factors which affect immunity. In a question like this, we all know the meaning of affect. Affect means something which has a negative impact. So when we're asked to talk about factors which affect immunity, it means that we are told to mention things which can cause the body's immunity to decrease. So in answering a question like this, it just requires you to mention them. So we're looking at the answers. We can just say our first reason or our first factor is poor nutrition. As we all know, the body system depends on the type of nutrition a person gets. A person who has a very good nutrition tends to have a very high immunity in their bodies, in which that's why a balanced diet is required for everyone. While if a person has a poor diet, for instance, in Zanzibar we have a problem of people taking in too much fats. In America also there's too much fats in our diets. We don't eat accordingly to what our body needs. That's why our immunities are so weak that you can hear every day people are suffering from illnesses. But if there was a proper diet, then our bodies would have had a very good immunity against disease. Moving on, we have the lack of vaccinations. We know that vaccines are just supplements or additions to our immunity so that our immunity increases in its functions. So a lack of vaccinations, meaning people who do not get vaccinated have a higher tendency to have a low immunity, in which they are prone to many infections and diseases. For instance, people who do not vaccinate against measles, rabies, polio, they usually have a higher risk to be infected by those diseases than those people who do not, or than those people who actually have been vaccinated against it. So a person who has a lack of vaccination has a higher chance of being infected by diseases. Another thing is genetic disorders. Even though it's at a lower rate, but genetic disorders affect a person's immunity. For instance, people who suffer from cystic fibrosis, people who suffer from thalassemia, and other genetic disorders, for example, cancer, diabetes, usually have a low immunity in their bodies. This is because the genetic disorder, when it's passed down from one generation to another, from one person to the next generation person, the immunity of the next generation's person is gradually weakened as it becomes weaker and weaker until it reaches a place where it fails to function. Moving on, we have incomplete treatment. In Zanzibar, this is a common problem because in Zanzibar we have a problem of not completing our treatment. For instance, if a person is suffering from malaria, then when the person does not finish the dose, as they take the medicine as told, but when it reaches a stage that they say that they feel better while they have not finished the dosage, then their immunity does not work as it was because it's very weak. So not completing treatments can cause the immunity to gradually weak. It affects the immunity. Also, we have a repeated exposure to infections. In this I'd like to talk about something in which we call tolerance. Most of the time when a person gets sick all the time, the pathogens inside their bodies are usually tolerating the medicine. But once they tolerate the medicine, also the person's immunity is affected as it gradually becomes lower than a person who has not been affected by many diseases. Also, we have attack by pathogens. When the body is attacked by pathogens, the pathogen's main purpose is to cause diseases inside the body. So the pathogen's main way of action is by weakening the immunity. The person's immunity gradually weakens and it becomes less strong. When it becomes less strong, it becomes easier for the pathogens to cause diseases inside the body. We have the use of immunosuppressive drugs. You can ask yourself, what is an immunosuppressive drug? An immunosuppressive drug is a drug which suppresses the immunity of the body. These are very common in blood transplant, in organ transplants, blood transfusions. These medicines are used to suppress the immunity so as to reduce the risk of a rejection during a transfusion or a transplant. So excessive use of these drugs can cause the immunity to weaken, as once the immunity is weakened, its functionality, its work rate gradually becomes lower than the beginning. We have extreme stress. Although people say that stress is something which is psychological, but having an extreme stress causes the person's immunity to gradually lower, to weaken, because stress usually affects the brain, and the brain produces certain chemicals, some certain hormones, which causes the immunity to be weak, and then the person becomes more prone to diseases due to stress. That's why it's advised for someone's health to avoid getting very, very stressed. And finally, we have damage to the skin. Most of the Form 1 students would ask themselves, why did we mention the skin? As we all know, the skin is one of the largest organs which is found outside the body. The skin actually acts as a natural barrier in which various disease-causing pathogens are stopped. But once the skin gets damaged, either if it gets cut, if it gets grazed, if it gets bruised, there is a very high possibility that an infection could occur, and the immunity at the place where the skin has been removed gradually weakens. So when asked a question on stating the factors which affect immunity, it's very important to look at what reduces the immunity's work rate. That is what is needed in a question like this. Moving ahead to our second question. Our second question is one of the most common questions asked in the exams. When we are told to mention the ways in which you can prevent the spread of HIV/AIDS. As you all know, HIV/AIDS is a pandemic in which the virus affects the person's helper T cells, therefore gradually decreasing the person's immunity and making him prone to opportunistic infections. So, as we all know, HIV/AIDS is a disease which is communicable, very, very communicable. So there are methods in which it can be spread, but there are also methods in which you can prevent the spreading of HIV/AIDS. Answering this question, it really requires a person's knowledge on how to decrease the spread of HIV/AIDS, on what actions should be taken to decrease HIV/AIDS spreading. So a trick in answering a question like this is that you ask yourself, what causes HIV/AIDS? Once you know what causes HIV/AIDS, you can just think of the opposite of what causes it. And therefore you could answer a question like this. So in answering a question like this, you can say, for example, by avoiding irresponsible sexual behavior. We can ask ourselves, why by avoiding irresponsible sexual behavior? We all know that HIV/AIDS is caused by sexual contact between two people, whether it be homosexual, whether it be heterosexual, same sex or different sex, but any sexual contact between an HIV/AIDS victim and a normal person can result into the normal person getting infected with HIV. So by avoiding irresponsible sexual behavior, meaning avoiding multiple partners, being faithful, or abstaining from sexual contact between two people, or even using some barrier methods, for example condoms, but using methods like this, avoiding irresponsible sexual behavior really reduces the rate in which HIV/AIDS is spread. That is because while using faithful ways, while abstaining from sex, there is no medium in which the HIV virus can pass from one body to another. We have another one, by not sharing toothbrushes, or in other words, by not sharing personal items. We know AIDS can pass through saliva, body fluids such as saliva, such as sperm, such as blood, and other bodily fluids. But by not sharing personal items, for example, by toothbrushes, sometimes people, when they brush teeth, they can bleed from the gums. It's a very common thing. but shaving blades, any personal items which you have should not be shared with a person with HIV/AIDS. This is to reduce the risk of being infected by these items. Also, we have by using sterilized equipment. We're asking ourselves, in the medical world, there are many equipments which are sharp. For example, there are scalpels, there are many things used in medical surgery, there are syringes. Sometimes it's better to sterilize them, as once they're used, they can be destroyed. But sterilizing them reduces the risk of having HIV, of spreading HIV/AIDS by sterilizing them, because sterilizing means heating it at a high temperature. As you're heating it at a high temperature, the virus do not die but are deactivated. So whilst they are deactivated, it can be safe to use it. Also, by screening transfusion blood. By screening, we mean just checking the blood for HIV viruses. So in the past, when it was not known, people used to not screen the blood. The blood for transfusion was just inserted or transfused inside another person's body. So the rate of HIV spread was very high. But by screening it, you mean that you check it thoroughly. As you check the blood thoroughly, it reduces the risk of having HIV/AIDS spread through blood transfusion. We have wearing disposable gloves. Why wearing disposable gloves? We know that a disposable glove are the gloves which can be thrown away or which can be incinerated with no problems. Wearing disposable gloves while handling body fluids is one sure way of reducing the risk of getting HIV/AIDS, because we are told and we know that HIV/AIDS passes through the body of one person to another through cuts and grazes and through bodily fluids. So while handling bodily fluids, in order to reduce the risk of coming into contact, direct contact with it, it's better to wear disposable gloves. Also, we have checking frequently on a person's status. A person does not know when or why or how did they acquire HIV, but checking frequently becomes a sure way of knowing someone's status, someone knowing if he is HIV positive or HIV negative. So by checking frequently, people can get knowledge, can know on what to act once they have been told that they are either HIV negative or HIV positive. Moving on to the third question. The third question states, your friend Harub is a victim of HIV/AIDS. Show how you can take care of him. This is a question which requires the person to think very carefully, as this depicts a real life scenario, something in which people live with, something which happens in a person's home place. So, for instance, the question is asking, for instance, you have a friend who has HIV/AIDS. It requires you to know, how would you live with them? How would you act with a person living with HIV/AIDS? That's what this question needs. So answering this, a person needs to think very, very carefully on what to do if he or she lives with the person having HIV/AIDS. So answering it, first of all, by behaving in a loving way to him. Why acting in a loving way to him? That is because we all know that sometimes stress, psychological abuse can hurt a person. It can cause early deaths. It can cause suicides. It can cause various problems if a person is hurt psychologically or emotionally. So by acting in a loving way to them, by showing them love, by showing them compassion, by showing them cooperation, you give them a feeling that they are worthy to live. So by acting in a loving way to him can help your friend, or can help a person living with HIV/AIDS to feel wanted, to want to live longer. Also, we have by listening to his problems and providing assistance wherever he needs it. In this way, a person living with HIV/AIDS needs friends, needs people who he can confide to, needs people to who he can talk to, people who he can ask for advice. By listening to his problems and providing assistance, you give him a sense of belongingness, a sense of wanting to be there, a sense of that he is important wherever he is. That's why by listening and giving assistance to him whenever they have problems is a good way of acting while living with them. Also, we have by counseling him to refrain from any behaviors which would increase the number of victims. We all know that sometimes HIV/AIDS victims feel that HIV is a curse which they have gotten from either God or anyone, but they should know that by telling them to act that the HIV/AIDS they acquired is not a curse, but rather something which they can act in harmony with it. So by advising them to refrain from acts, for example, like prostitution, drug abuse, things like that, by telling them to refrain from it, by counseling them to release themselves from those kind of things, can cause them to reduce the amount of HIV/AIDS victims, as telling them to stop would stop any further acts which would increase the rate of HIV. Allowing him to work wherever he can. By allowing him to work wherever he can, you give him a sense of independence, that whenever a person with HIV/AIDS wants to work, the person should be you should let the person work, because once you let them work, it becomes clear to them that they actually have a choice in things. Whilst telling them not to work because they are weak, because their body condition, it gives them a feeling that you do not want them to work, you do not want them to contribute to the society. They feel that they are nothing but prisoners, they are nothing but walking corpses, they are nothing but things or people who are better off dead than alive. So by giving them independence in their choices, it gives them a feeling of independence, a feeling that they can contribute to the society. Moving ahead, we have providing them with a well-balanced meal. We all know, as we talked in the beginning, that immunity is affected by the nutrition diet. By providing him with a well-balanced meal, you can give him a boost in their immunity. As we all know, HIV/AIDS works to reduce the person's immunity. By giving them a boost in their immunity, you can give them a longer period of living than while living on a poor diet. Allowing him to rest whenever he feels tired. Also, this shows a sense of cooperation with them, as people with HIV/AIDS tend to have weaker bodies, tend to have bodies which get tired easily. So by not tiring them consistently, you can give them a better chance in cooperating with others, you can give them a better chance in providing, you can give them a better chance in even decision making. Taking them to a healthcare center whenever he feels ill. Why should we do that? Because it's our duty, it's our responsibility. With people living with HIV/AIDS, they need to constantly go to the healthcare center because their immunity is very low. There are many opportunistic diseases which affect them once they gain HIV/AIDS. So by taking them constantly to the healthcare center, you can remove the opportunistic diseases and give them a better chance at living. Also, refraining from discriminating them. Why should we do this? Because we said it in the beginning of the question, in the first answer, that discriminating them causes psychological stress. Causing psychological stress to a person living with HIV/AIDS further deteriorates his immunity. Once his immunity becomes very low, it becomes very easy to gain infections and to die easily. So by refraining from discriminating them, for instance, calling them walking corpses, saying that they are cursed, saying that they have no purpose, they have no meaning, refusing to even cooperate with them, that would all cause an early death to a person living with HIV/AIDS. So refraining from it is very, very good to refrain from discriminating them. Now moving on to our next question. We are told to mention any 5 communicable diseases and mention their causes and symptoms. This is a very direct question. We all know that communicable diseases are diseases which can be spread from one person to another through various means. So, a question like this can be answered by, first of all, drawing a table in which one column you write the disease name, another column you write the cause or transmission, and in another column you write the symptoms and signs. For instance, the question in the answers chosen here, it shows that one of the 5 most common diseases in Zanzibar. And in writing a disease, it's better to write a disease which is known in your locality, known in where you live. So beginning, we have gonorrhea. Gonorrhea is an STI, a sexually transmitted, an STD, a sexually transmitted disease. Any sexually transmitted disease is known to be caused by sexual contact. But our first disease, we have gonorrhea, and its cause or transmission is sexual intercourse. We all know, as I said, an STD is a sexually transmitted disease, a disease which is transmitted sexually, and gonorrhea is a bacterial disease. It can be caused by having sexual intercourse with the person having gonorrhea. It can also be caused by sharing personal items such as toothbrushes, razor blades, towels, and so on and so on. Also, an infected mother to a child. A mother who has gonorrhea can pass the bacteria to the child due to the fact that they are connected by the umbilical cord. It has many signs and symptoms, but the most common one is a foul yellow discharge from the penis or vagina. In gonorrhea, one of the most common symptoms is a foul yellow discharge. It can be very thick. It's very thick, very frothy, and it has a very bad smell, in which occurs in the sexual organs of the people who are infected. Pain when urinating. This is because whilst the bacteria mostly converge or mostly affect the urinary system. In the urinary system, the urethra is affected in both males and females. That is why there's a certain pain while urinating. Retention of urine in males. We all know that in males, the urinary system and the sexual reproductive system are in the same place. The passage of urine is passed through the urethra, and also sperms are passed through the urethra also. So in the urine pathway, which is affected by bacteria, it can block urine from passing in males. We have itching in the private parts. Due to the infection, there is a slight itch. There's a feeling that you need to scratch yourself in the private areas, as in that is the penis and vagina. Due to that, scratching a person, the feeling, if it occurs very long, there's a slight possibility that a person has gonorrhea. Also, irregular menstruation in females. We all know that most females after puberty they have menstruation, but having menstruation means it happens in a regular rhythm. But the bacteria, once infecting a person with gonorrhea, causes irregular menstruations which occur without a cycle, without a rhythm. So gonorrhea also causes something like that. Gonorrhea, a sign of gonorrhea is that. Moving on, we have cholera. Cholera is very, very common in Zanzibar. In Zanzibar, cholera is very common, and it has its periods. It has its outbreaks. But it is caused. What causes cholera? What causes cholera is nothing more than bacteria spread through contaminated food or water, in which the bacteria known as Vibrio cholerae are passed through the food or water. It has its signs and symptoms. Its signs and symptoms are diarrhea, vomiting, weight loss, wrinkled skin, and muscle cramps. Why are these? This is because the cholera bacteria act on the water, on the fluids of the body, releasing many, many fluids. That's why a person loses water. That's why diarrhea occurs, vomiting occurs, the weight loss, the wrinkled skin, the muscle cramps are all due to the loss of water inside the body. Moving on, we have malaria. Malaria is also another common communicable disease in Tanzania, in Africa, in the world. Malaria, as we all know, is caused by the female Anopheles mosquito, in which there's a protozoa or the plasmodium inside its saliva. So once a person is affected by the plasmodium, they show symptoms of malaria. Symptoms which include chills, fever, sweating, nausea and vomiting, pain in joints, headaches, and abdominal pain. All of these are caused by the plasmodium when it affects the person's red blood cells and the liver. This is what is caused by malaria. This is what malaria does. These are the symptoms of malaria. So if a person shows these symptoms, they should go immediately to a healthcare center and be checked for malaria. We also have tuberculosis, or in short, TB. TB is a disease, a communicable disease which is common here in Tanzania, common in Zanzibar, common in many parts of the world. It's a pulmonary disease, or a disease which affects the lungs. How is it caused? It's caused by bacteria spread by droplets. Bacteria which are spread by droplets when coughing or sneezing. As you all know, when a person coughs or sneezes, they release droplets. These droplets contain many, many bacteria. So if a person is in close distance with an infected person, there's a higher possibility that they gain TB. And how would we know a person has TB? They are known by having a prolonged cough. They have blood-stained sputum, in which this refers to the spit, the heavy mucus, which is stained by blood. This is what sputum, blood-stained sputum means. They have a fever. They have a poor appetite. They have weight loss, a lack of energy, and night sweats. If a person shows these symptoms, there's a high possibility that they have TB. So the best course of action would to go to a hospital where they can start treatment immediately. Moving ahead, and finally we have Bilharzia, or in another word we can call it schistosomiasis. This also is a common disease found in Zanzibar and in other parts, but mostly where there is water snails or water bodies. So what is caused by, or what causes Bilharzia? The only thing which causes Bilharzia are blood flukes which are spread by water snails. These flukes enter the person's body whilst the person is playing in water and through other ways. But they have their symptoms also, and that is blood-stained urine and feces. This is due to the rupture of various small vessels, or the rupture of red blood cells inside the body, in which once they are passed out through the urine and through the feces, they appear, and that's what causes the bloody appearance of feces or urine. We also have abdominal pain. We have diarrhea, fever, tiredness, and an enlarged liver and spleen. The enlarged liver and spleen are what causes the abnormal release of red blood cells, as the spleen is responsible in creating red blood cells and the liver is responsible for destroying red blood cells. So a place in which the liver and spleen do not function properly causes the release of red blood cells outside of the body. This also gives the blood appearance of the feces and urine. Moving ahead to our final question, where we are asked to show how you can maintain good manners during puberty. That is, a question like this asks us, this question requires a person to think very carefully on what the asker needs. What the asker needs is that a person to reflect or to answer on how he or she would act once they have entered puberty. As you all know, puberty is a transition state from childhood to adulthood. And in males, its age is mostly from 13 to 18. While in females, it's from around 12 to 17, 18. That is the age of puberty. So, in this age, it's a very, very difficult age. So, acting on good manners is very important. So, by answering a question like this, the question can be answered as follows. First of all, by resisting negative peer pressure. As we all know, in an adolescent or a person who has reached puberty's years, friends and peers are very important. The peers can be friends, parents, religious leaders, teachers, and so on and so on. But resisting negative peer pressure, we all know that we have some friends who advise you just to go drinking, to engage in sexual acts, to steal, to do lots of bad things. But resisting them by telling them, no, I cannot do this, that is one way in which you can show that you have good manners during puberty. Another one is by getting counseling from reliable sources. We all know that puberty is a very tiring time. It's very trying. It requires a lot of attention. So by gaining counseling, or by getting counseling for a person or from a source which brings you good, is very important. As for instance, you can ask your parents on good advice, religious leaders, teachers, friends, all of them, all of those who give you good advice can help you gain good manners during puberty. Also, we have abstaining from sexual promiscuity. Abstaining from sexual acts. During puberty, we know that the body changes from that of a child to an adult. And in this period also, people would like to experiment on different things. But refusing to engage in sexual acts is one of the most best manners shown by a person who is in puberty. So by refusing to enter into sexual acts, it shows that a person has good manners. We have getting involved in positive extracurricular activities. What are extracurricular activities? Extracurricular activities are activities which are done after studies, which means apart from studies, what does a person do? There are many types of extracurricular activities. There are negative ones and there are positive. Negative extracurricular activities can be just smoking, drinking, sexual acts, games such as video violence games. Things like that are negative extracurricular activities. Positive extracurricular activities can be debates, quizzes, can be sports, engaging in sports, can be religious studies. All of those are positive extracurricular activities. By engaging in them, you can reduce the risk of doing bad deeds, of doing bad things, by refusing or by engaging in positive extracurricular activities. And also being respectful to your elders. In Zanzibar and in many parts of the world, respect is something which is very, very needed. Respect is something which is very, very seen. Elders are needed to be respected, even if you do not agree with them, even if you do not see their point of view. You should not say, or you should not tell an elder that they are liars. Instead, you should say that it's not true, but I think it's in a better way. Or you agree with them and then show them a better way. But not respecting them is a sign of bad manners. So by respecting your elders, even though you do not agree with them, shows that you have good manners. And we have finally apologizing when you hurt other people's feelings. We all know that we can agree with some people and we cannot agree with other people. But whilst we have an argument or a quarrel, it's very good to apologize. For example, if you tell someone something which hurts them very much, it's better to apologize instead of showing that you are superior than them, laughing at them. Things like that are very, very negative and show that you have bad manners. In order to show that you have good manners, it's better to apologize by saying, I'm sorry, I was wrong, so can we be friends again? Can we start over again as friends? Being quick to say I'm sorry is a sign that you have good manners. I'd like to stay and talk to you more and answer more questions, but that is all for today. Join us next time as we continue to answer questions based and brought on exams on the subject of biology. Thank you.